Okay, so the question is, we have a patient, John, who had a report of doing great. His diabetes is gone, he's feeling better, and he said, oh, by the way, he didn't say it was a really big deal, but the past couple of nights I've had, he described it as acid reflux. Okay, warning, attention, pay attention to this. This is the big deal. Remember a few minutes ago I told you that I've been asked as a consult to see a Roux-en-Y gastric bypass patient who's in our intensive care unit now, who's had the Roux-en-Y gastric bypass. Did I mention it was a Roux-en-Y gastric bypass, not a mini-gastric bypass, who's bleeding massively from an ulcer from her surgery? Okay? It turns out that around the world and around the country, most other doctors don't like the mini-gastric bypass because they're worried about reflux. They're worried about the connection, having bile coming back, irritating things, and causing ulcers and bile reflux or acid reflux and problems like that. And you just said you had 2 episodes where something burny, you called it acid reflux, came back in the back of your throat. So I want to go over this with you, give you a good explanation, understand what's going on, what to expect, and what to do. Okay? Now, again, every day, thousands of my patients, for over a decade now, have bile, detergent, digestive juices pass by their stomach on the way down their intestine. And this connection is what worries other doctors. So they don't do the MGB because they say that connection is going to cause trouble. Okay? But thousands and thousands of my patients have that connection and do fine every day. All right? But now let's imagine that you got an ulcer or an irritation or gastritis at that connection, at that junction where the stomach goes into the intestine. What in your mind do you think might happen? Well, I'd like to explain what might happen by telling you 2 other scenarios. I'd like to describe 2 other things and then come back to what happens when you get an ulcer in the mini-gastric bypass. I want you to imagine that it's a hot summer day outside and we mow the lawn and we come in after mowing the lawn and we drink a big glass of freshly squeezed lemonade with sharp, acidy, real lemons in it, and you just drink that down. Can you imagine that situation? Now do that same thing, mow the lawn, come back in and take that big glass of lemonade, but you've got a quarter-sized cold sore ulcer in your mouth. Got it? Oh, in your mind, can you see that happening? Almost a spasm when that hits, that acid hits that area. Okay, stop that idea and let's think of another thing. Good news, we've all won a free trip to Hawaii. And in our mind, we all get on a charter jet, we all walk out to the beach, and we walk into the warm surf there at Waikiki Beach. Right? In your mind, you've got that? Now, instead, we're all walking out to the beach across the lava rocks on the way to the beach, and I'm talking, and I kind of turn around, and I trip, and we all fall over, and we're all cut up. Our knees and the front of our legs are all cut up from the lava rocks, and then we walk into the ocean with those cuts. Okay. The mucosal lining or the skin protects us from the pain, but when that lining is broken, when the skin is broken with a cut, then the seawater hurts, the open cut. When the mouth is protected with the mucosal lining, you can drink lemonade and orange juice and it doesn't burn, but if you get a cold sore or an ulcer, all of a sudden that acid burns. Take that experience now in your mind and let's imagine that you had an ulcer in your stomach where the MGB connects the stomach to the intestine. Now, when the soapy bile detergent comes by there, it can hurt. Or it can even spasm, and if it spasms, you can get bile reflux or acid reflux. So when you have that event you described, the first thing you should do is you say, "That son of a gun, Rutledge, he's given me a darned ulcer." Or it doesn't have to be a frank ulcer, it could be a little gastritis or something like that, and then you need to call me and then we need to treat that ulcer. as soon as we treat the ulcer with anti-ulcer medicines like the Prilosec and Tums, and make sure you're eating your yogurt, we'll make that get better, and that reflux and burning and all will go away. But if you don't pay attention to us, then you can get problems with that ulcer as it gets worse and worse. So we recommend that every one of our patients every morning should do the orange juice test. Okay, the orange juice test means drink some fresh squeezed, tart, acidy orange juice every day. And if you drink that in the morning and you say, boy, that's good, no ulcer. If you drink it in the morning and you go, again, take my name in vain and call me and say, hey, I got a darned ulcer from your surgery, you son of a gun. And do I get a refund? I go, click. Hello? But, yes?
I got an ulcer. Can I get a refund?
Click. So here's the thing. Pay attention to this, because remember from your manual, remember from the unfortunate lady who's in the ICU today with the Roux-en-Y gastric bypass who has a bleeding ulcer. Ulcers are our biggest problem after the surgery. Now the nice thing is we can tell you how to treat them and how to prevent them. So how do we prevent them? No alcohol. No alcohol. Okay? No soda pop. Okay? In that chair, right where you're sitting in the back corner, we had a very nice young lady who had the surgery 4 years ago. Okay? She didn't have a lot of friends. She had the surgery. She got better. She found a very nice man, got married, was having a wonderful life, and forgot about me and the MGB. Because she's thin, no more problems with being overweight. She was young, so that, you know, her abdomen and all that just snapped back. She was having a wonderful life. And by forgetting about me, she forgot about all the things we told her to do to protect against an ulcer, and she began drinking Mountain Dew and came in with a perforated ulcer in January. Perforated ulcer. And when I came out to talk to her family, her dad and her son came out running up to talk to me and say, she's been drinking 6 Mountain Dews a day, Dr. Rutledge. And I go, okay, now tattletales. Because I said, now when she gets better, we have to talk with her about that. And her dad's this crusty old guy. Nah, let's get her now. No, be nice. And so, again, pay attention to protect yourself against this, the biggest complication of our surgery. What do? Don't take aspirin. Don't take Motrin and Aleve. Avoid those things. Don't drink alcohol. Don't drink coffee. Don't drink soda pop. Choose healthy foods, because that will help protect the lining of your stomach and protect you from ulcers and gastritis. And that is the biggest problem that we see in our patients, and we know how to protect against it, but you have to pay attention. Also, remember, in our manual, we give you some other advice. We say take your Tums. Eat yogurt every day. Remember, the yogurt has the good bacteria that helps protect against ulcers. Eat a healthy diet with lots of high fiber in it. Take your extra fiber, things like that. So pay attention. And what we see in our patients is 3, 4, and 5 years from now, you're going to forget me. Okay? That's just what happens. The heavy person that you used to be, your diabetes, all that's going to melt away, and it's going to be hard to remember me and the surgery. And when that happens, our advice will also get very faded in your memory. And if that happens, you could have trouble. So I'm doing the video today. It's you know, that's kind of a long answer for your short little question. And the bottom line is beware of ulcers and gastritis after the surgery. It's our biggest problem, and you can protect yourself against it kind of by just like putting on your seatbelt, knowing that you could have problems and doing the things that can protect against it. And then, God forbid, if you get that problem, call me, because we can fix it. Got it? All right, good.